Well, there are so many things to think about when you're pregnant, but this may not be the first thing to come to mind: dental care for mom.
That is why we bring in pregnancy expert Judith Schuler every time to keep us on track with everything we should be thinking about. So, dental work.
Yeah, well, anything to do with your teeth.
Yeah.
It's very, very important to take care of your teeth. Some people have asked me, they've said, I've heard you shouldn't go to the dentist at all while you're pregnant. And I said, no, it's exactly the opposite. You really do need to see your dentist, because tooth care, we're talking about flossing every day, brushing 2 or 3 times a day, so important, because your teeth, actually, we'll talk a little bit in a minute, can affect your health if your teeth are not in good shape. So we want you to see the dentist. Try to wait until after the first trimester if possible, but do make sure that you go to see your dentist at least once during your pregnancy.
Well, that's why I'm so glad we have you on, because you always kind of clear up those myths that we've always heard. Now, let's talk about why we need to try to wait until after that first trimester. Why is that?
Well, anything that you do or take or are exposed to, during the first trimester, the first 13 weeks, can affect a pregnancy negatively. And so that's why we're always warning people. Now, if you have an emergency, you break a tooth, you've got an abscess, a filling falls out, you can't wait. You have to take care of that immediately. And when you do, make sure when you go to the dentist, you tell him or her that you are pregnant, because that's very important for the kinds of products they may use or procedures they may do. So don't wait if you have a problem, but if you can, wait until at least after the end of the first trimester.
So what about things like antibiotics or pain medications or something that might come along with a procedure?
Right, those are necessary. I mean, you don't want to suffer and you don't want to risk an infection, but your dentist knows about these things, and if they had any questions, they could always call your pregnancy doctor. There are many pain medications and antibiotics that are safe to use during pregnancy. So don't have a problem with that. If somebody says, I would like you after a procedure or something to take these antibiotics, or here's this pain medication, it's okay. Just make sure it's the right kind that you can use.
Okay.
Well, that's good to know that there are some safe options for pregnant ladies out there. Now, I know every time I go to the dentist, when the dental assistant puts the thing on to take the x-ray, she always asks, is there any chance that you're pregnant?
Yes.
So that's something to make sure we're always communicating.
Right, that's why you want to tell them.
Now, what about if you have a cavity or something that needs to get fixed that's a little more invasive? Anesthesia, is that something that we can even
Anything
think
that
about?
they use, like lidocaine or xylocaine, something, in your mouth to numb an area, to do a filling or replace a crown or something, that's okay. That's not going to be a problem. It's the general anesthesia, like when they have to pull out a bunch of teeth, or maybe your wisdom teeth, or you've got you have to have a root canal and you can't do it with just regular lidocaine or xylocaine, then yeah, that's something you want your dentist and your pregnancy doctor to talk about together before any procedure is done like that.
And I know you mentioned a little bit earlier about your gums and how important they are. I think your health of your teeth is important, pregnant or not pregnant, because like you said, it can affect the health of your complete body, but why gums so much when you're pregnant?
Well, there's a pre-periodontal disease called gingivitis, and that's where you have red gums, they're swollen, they bleed. That means you really haven't been taking good care of your teeth. If you floss every day and you brush, that takes care of that. What happens when you have gingivitis, when you have this infection in your gums? That infection gets into your bloodstream. And that, we know that in the humans, in the parents, in the mother, it can cause like heart disease if it's extended. And all of that infection can pass to your baby in the blood that you supply your baby. So you really need to take good care so that you don't get gingivitis, so that you don't expose baby, because it can cause problems in baby over the long term. So teeth are very, very important, not just for eating.
Well, I think this is such a great topic, because when we think about kind of prepping to conceive a child, we think about our diet and our exercise, but I have to admit, this is not something I thought about. So as we're kind of trying to eat healthier and everything, we want to maybe go ahead and visit the dentist now.
Yes, yeah.
Kind of see where we stand, and then it's so important that we keep up with that daily regimen of, brushing regularly and flossing. I think
flossing,
this is so important.
That's the one that really, really does help out your gums, is the flossing every day. And most people don't think about that. So take good care of your teeth, and it'll help take care of your baby.
Well, Judy, this is why we have you on, to kind of think of all those things that we haven't thought of yet. So thank you so much for visiting us, and please come back soon.
I will, thanks.
All right, and to learn more about your pregnancy, make sure to check out Judith Schuler's series of books. For more details, log on to yourpregnancybook.com.